Bubuleta and we're in the car bouncing.
We'll find out from the that's someone around here.
Okay, let's go.
That's the Bubuleta CHO. Oh, that's the sister in charge. She's coming.
The health post generally is a relief to most of the people of this place. We look after catchment of Istawala, that's Huhu, comes under Huhu LNG, and we cater for about 7 wards and a population of 5,600. So people access, we've got about 5 aid posts within the catchment, and they serve the nearby villages. That's from Walala to Gopaya.
Find anything complicated
So
with the patients and settings?
Okay, for the month of August, most of our patients that accessed the community health post were asthmatics. We had few patients that came in with severe asthma. We had to settle and send straight down to the hospital.
We are having different types of cases, sicknesses that are coming in, and we also...
What are some of the new cases?
Let's say at the aid post level, we only have minor cases coming in, and then we treat there and we refer to the big hospital.
You said new cases.
Here we have asthmatic patients, pneumonia patients that are treated in here and then sometimes sent back home, or if they are not recovering, we refer them to the hospital.
That's right. How many staff do you have here?
We have the ceiling staff for the CHP, supposed to be 3. One nursing officer who has a big background of midwifery. And then we should have another health promotion officer and another CHW who is well trained with child and maternal and child care. So at the moment we have 2 who are residing here, the nursing in charge, plus another CHW. We're still yet to have our health promotion officer to come in. But then we have 2 extra officers, CHWs, who are helping us at the moment.
What do you mean?
One is supposed to be at the hospital, but because she lives up here, they found that it's quite a distance for her to go to work every morning and come back. The people are very grateful. It's a relief for them going all the way to access Alotau, especially from this end. To get down there, it's about 5 kina you pay to go down one way. And if you have to go and come back, it's 10 kina bus fare.
Do you do deliveries here as well?
That's right, yes. For the month of August, we've done 4. And for this month, we've done 1 so far.
Were they successful?
Yes, the normal vaginal deliveries were successful.
Okay. So has there been any deaths that occur here?
No.
No deaths. Can you show me the areas? Hang on, I'll take off my shoe first. Take off your shoes there, boy.
This is the waiting bay. We have the waiting bay for our patients that come in. So when the patients come, they sit here, and then from here they access and go. Usually we see our patients, those that are very sick, we bring them in first. So we come in, we have the nursing station here. This is where the staff access to give report and also to receive patients, guardians, visitors who come in here. So we receive them in here. It's the nursing station. The solar is connected. We operate in solar, using solar, but we decided not to put on the fridge because we feel if we put on the fridge, then it will use up most of the power for the whole health post.
How do you keep your vaccines and all this?
The vaccine?
Yeah.
We have a vaccine storage fridge here. This is where we keep our vaccines. It's also solar operated.
So it's operating now?
Yes, it is.
Okay.
We've got our vaccines also in there. So we immunize at every opportunity. When children come in and we know they're due for vaccines, we vaccinate. All our patients come in when they're not many. This is the place that they access. This is another waiting bay. They come in here and then they consultation one.
This is the consultation.
This is the consultation one. In this place we have the staff and also patient. We see one at a time. So we are able to really talk to the patient. The patient also has more privacy. Yes, so we have everything in here. We have our drugs. We also have the examination bed and everything that we need in here. So what we do is you just examine a patient, you treat the patient, and you send the patient away from here. So they do not go anywhere else. They come in here and go out. We have another room here, consultation tool. This is mostly the MCH place, maternal and child health. We do immunization in here, family planning, antenatal. Everything is carried out in here. So this is the place they access through, waiting bay. So they do not come in with all the patients that are sick. We separate them because they're not sick. They only come and access this way and then they go out.
Why would they come inside and access this room if they're not sick?
Because they come in as family planning clients. We also see antenatal and babies children who are well and come in for immunization. So they only access this way to come in, they get set and then they go out the same way.
Right.
Okay, this room here is a health promotion place.
So you have the hand washing
Yes.
posts.
They put on all the sinks, so we have all that on every sink. We'll also be using this place for nutrition cooking. When we have children who come in here and we think that we're able to teach mothers how to do proper cooking, then this is the room we'll also access to them.
Good one. So the floor is nice, tilted.
Yes. This is our dispensary.
That's where you keep all the medicine.
Yes. At the moment, this is on the 8-post kit we're using. The health post still doesn't have the 100% kit. This one's here, the Bubuleta, when it was still an 8-post at the time. These are the drugs that have been brought up here, so we're using them.
Do you have enough drug supply here?
No, we don't have enough.
What do you mean?
At the moment, for last month, we had a lot of patients who came with upper respiratory tract infection, and we just ran out of the basic antibiotics.
The Danish Department of Health ensures the drugs reach our nation, our sea France. So it's the responsibility of the provincial health authorities to follow track on it, and also it lies on you. You have to put your request through from the supplies department of the PHA here, and you can get your drugs and all this. We have supplies of drugs just because they don't follow up to get their drugs and all this one, so most of the drugs we still have a lot of drugs.
Yes, our nest went on yesterday. We also were assisted by Guinea Health Center.
That's right.
So we did an order for the basic antibiotics and she brought out some. I also did a big order and gave it to Trista David. That was last week. So it has gone in. We're just waiting for the response. We have this place here. This is the admission place. General admission. Patients that we feel we could keep for up to 3 days, they access this.
New man. Have you admitted one yet?
Yes, we've admitted about 10. Yeah. Because it's a community health post, we do not want to keep patients for a longer period of time.
Definitely.
So we keep them for about 2 to 3 days. By the 3rd day, we should decide where they go. They either go home for supervised treatment at the 8 post or they transit out to the hospital. So it's more like a place where we just keep, assess, and then we make a decision. So the patients also have their bathroom and shower. They just access this room.
Okay.
So this is the place that they access.
That's for both male and female.
Both male and females. Please.
That's nice.
This is our dirty utility place, our sewers, where we do our decontamination before we send waste. We've got 2 bins. One is the general bin and this is the medical waste.
When this is filled up, where do you dispose this?
We have our incinerator down. We usually do it every 2 days.
Can we go and see an incinerator? Or is there any other place that which you
Yes,
would like to
we'll
show?
go in and then later go.
Okay, good one.
So we finish from here. This is the clean utility. This is where we do all the cleaning. So after the decontamination, we come into this room, we do the rinsing, dry the tins, and then they're packed for sterilizing.
How do you sterilize them?
We pack the tins and we still send them down to the provincial health office, provincial hospital for
Sterilization.
sterilization. Yes, we've got the benchtop sterilizer. I'm also supposed to do the commissioning and also the use of it, but then it wasn't done, so we still have it here.
After the commissioning, you want to use it?
After commissioning, yes, we're supposed to be taught how to use it, but then we were not taught how to use that because they came and they found out that the generator we have also in the solar, we have to put off everything if we want to use the benchtop sterilizer because it's energy. So at the moment, packing is done, we take it on to the provincial hospital and then they sterilize the sample. Area, and then the postnatal. This is where we keep our mothers who come in to deliver. After they deliver, we keep them in this room for 3 days. And we observe if we're happy with the baby and the mother, we send them home from here.
That's the bathing suit.
This is the bathing suit. This is where we do our deliveries. Our mothers that come into labor. This is where we do the deliveries. So far for August, we've done 4. This is because we're in a rural setting, most of the women would prefer to stand, or at least in the villages, they tie a rope and women sort of hold on to the rope and also have the baby. So we do that here. The women come in and they're given an option, whichever way they want to have their babies. They're not forced up onto the bed. If they don't like it, then there are options they could take. So this is one of them, where a mother in labor will be able to hold there, and then she's able to squat and push at the same time. So she can do that. We also have a bedding. We have a bedding mat here. It's like a yoga mat. We also put on the floor, and then the mother decides if she wants to have her baby squatting, kneeling, and we have this. So she is able to just use this, and then she squats and have a baby. This is where we do the incinerating. Where we place the rubbish and then we do the gun.
Okay. All the waste goes down.
All the waste is bent and then
It
the
goes
ash
down.
goes in
And
there.
how do you get rid of the hash? That's the outlet.
This is the one that we will access through.
Okay, it's alright, don't worry. That's a new generator.
Yes,
Is it operational?
it is,
It is.
but it's only on standby. So we're using solar at the moment. Everything is solar operated until if the rain continues for a very long time, the lights are dim, then we'll access the generator.